Meet Richard, a 24-year-old part-time pro arm wrestler, part-time university student. He lives an exciting life that he thinks keeps him at peak fitness, but where he falters is his diet. He's been living carefree whilst in his tertiary study, but little does he know, he's about to receive a rude awakening. Although he has an active lifestyle, it's not particularly balanced, and as a result consumes over 10 kebabs a day. Here he is studying for his Med-Eng cardiology topic, looking over different heart diseases. He discusses it with his colleague and states that his fitness will prevent him from being affected, but he doesn't take into account his diet and any other predisposing factors. And speaking of heart attacks, right on cue. So what happened? How did this happen? And where do we go from here? After arriving at the hospital, the doctor ran some blood tests. The doctor came back worried about his condition. But let's see why.
When lipids are absorbed into the blood via microvilli on the small intestine from food, they are converted into one of two energy sources. The first is storage as adipose tissue for energy reserves, and the second is in the bloodstream associated with chylomicrons, a type of lipoprotein. These are then sent to the liver, which synthesizes them into various types of lipoproteins. Lipoproteins are spherical structures containing proteins and lipids and cholesterol esters. They're a protein-lipid complex which allows non-polar lipids to be transported in polar blood, and they are of different densities and sizes. There are 5 types of lipoproteins. Chylomicrons contain very high triglycerides, low cholesterols and cholesterol esters. Very low density lipoproteins contain high triglycerides and low cholesterol esters. Intermediate density lipoproteins contain high cholesterol esters and low triglycerides. Low density lipoproteins contain very high cholesterol esters and low triglycerides, and high density lipoproteins contain high cholesterol esters and low triglycerides. Chylomicrons are the largest but the least dense of the lipoproteins, and high density lipoproteins are the smallest but most dense. As we can see from the image, as the amount of cholesterol esters increase in the lipoprotein, the density of the lipoprotein increases, and also the density of the protein content also increases. LDL receptors in the liver detect cholesterol associated with low density lipoproteins, and receptor-mediated endocytosis enables various fat-utilizing cells to take this cholesterol in. Hyperlipidemia describes the accumulation of fats in the blood vessels due to excess fat being present. This can clog arteries, and fun fact, blood cholesterol levels can be as high as 2.5 grams per liter. Accumulation of fats in the brain can cause stroke. Accumulation of fats in peripheral organs such as the limbs can cause clots and limited oxygen delivery. But in the case of Richard's condition, he has suffered a clot in the coronary artery due to accumulation of fats, limiting the blood flow to the heart. This can cause coronary heart disease, chest pain, and eventually heart attack. There are 5 types of hyperlipidemia. Richard displays type 2A hyperlipidemia, suggesting he has very high LDL cholesterol, which has caused an obstruction in his coronary artery. Richard displays symptoms such as
There are 7 main drug classes in anti-hyperlipidemics. The first one is statins, which function to inhibit synthesis of cholesterol, specifically targeting the precursor molecules found in the liver. An example is simvastatins. Then we have the bile acid secretins, which convert cholesterol to bile acid, decreasing levels of cholesterol in the blood. An example of a drug is cholesterolamine. Then we have fibrates, which decrease levels of LDL cholesterol by decreasing the conversion of VLDL to LDL. An example of this drug is fenofibrate. Then we have PCSK9 inhibitors, which was the drug class that Richard was introduced to. It removes LDL cholesterol and will be elaborated on later. Now we have cholesterol absorption inhibitors that reduce the absorption of cholesterol in the intestines. An example of this drug is ezetimibe. Lastly, we have the miscellaneous anti-hyperlipidemic agents that target the DGTA2 enzyme to prevent synthesis of cholesterol and triglycerides.
Now, Richard's doctor prescribed alirocumab, a PCSK9 inhibitor. Now, what does PCSK9 stand for? It stands for proprotein convertase subtilisane caxin type 9. Now, how does it work? The enzyme PCSK9 causes LDL receptors in the liver to degrade, meaning LDL will remain in blood. However, with an inhibitor, which is an antibody, you prevent this action and lead to LDL being degraded and thus lowering LDL levels in the blood. Since Richard cannot control his food intake, the doctor has no choice but to prescribe a drug which prevents his body from absorbing more dietary cholesterol, and that drug will be ezetimibe. Now, how does this work? The drug will bind to mediator proteins in the small intestine epithelial cells, which will block the cholesterol from being absorbed into the body. Now, what will happen is this will decrease the cholesterol to the liver from dietary sources, which is the kebabs in this case. Now, this would mean that because of the inhibition of the reabsorption, hepatic LDL receptor activity will increase and therefore lead to increased clearance of LDL cholesterol from the blood. So the LDL levels did drop, but it comes at a price.
Hyperlipidemia is an underlying molecular condition which leads to various diseases as mentioned previously. However, there are several lifestyle and genetic factors which can lead to or aggravate this condition. According to the Heart Foundation, the following statistics have shown that cholesterol can be influenced by gender, where in 2012, 32% of all Australian males and 33% of all Australian females aged 18 and over were diagnosed with high cholesterol. Body mass index, where 1 in 3 Australians who are overweight or obese were diagnosed with high cholesterol. Age, where close to 1 in 5 Australians aged 18 to 34 were diagnosed with high cholesterol. This became significantly higher for those in 55 to 64 bracket, with almost half the age group having high cholesterol. And location, where Australians in regional and remote areas were more likely to have high cholesterol over major cities. Overall, however, it also highlights that around 1 in 3 Australians in each state will have high cholesterol. This table summarizes the values of lipids you should look for in a blood test. This table shows the values of a healthy individual should aim for. And finally, this graph puts a global socio-economic perspective on cholesterol levels, primarily identifying a difference between the African continent and Americas and Europe, and the difference between a low-income and a high-income nation. Overall, hyperlipidemia can be treated with anti-hyperlipidemics as a symptomatic treatment, but lifestyle changes like the ones found here are the best preventative medicine.
Help! Help! Help!
This way, your job's a joke, you broke, your luck